which is Innovation Awards 2007. Its aim to salute the creativity and the excellence of healthcare professionals, scientists and academics. Men and women who work tirelessly for the good of others until they experience that eureka moment, the birth of a brilliant idea.
But it's true to say that until these awards were created 6 years ago, many of these brilliant new ideas went nowhere, remaining unseen, uncelebrated and basically unused. But more importantly, no patients were able to benefit from them. But now all of that has changed.
A surgical team at the University Hospital of Wales in Cardiff picked up a medical Oscar last night. Professor Mansell and his team were awarded the Gong for developing a probe that can test within minutes whether cancer has spread.
A doctor from Leicester is developing a magnetic hip replacement he believes will slash the number of hip operations that patients have to endure. Plus, the magnets that make new hips last longer.
We hope to prevent long-term loosening, failure and the need for further surgery.
Scientists based at Milton Park near Didcot have developed a way of injecting medicines under the patient's skin without having to use a needle. The inventor from Abingdon is in the running for a prestigious Medical Futures Award in London tonight.
It's called the Glide Solid Dose Injector, and basically what this is, it's a device for firing a drug in tiny, tiny solid pellets.
Nominated for a medical Oscar, the surgical team whose work is bringing hope to thousands of women with breast cancer.
Cardiff is the only centre in the UK using this test, but they're now training colleagues throughout Britain in their techniques.
Mirror therapy, which produces an image which looks like the lost arm or the affected arm, but looking there or working properly. You know, if you produce that image in the brain, you can change the process of stroke management.
It's a very simple system. We have the drug in a small rod similar to a sugar needle, and it's pushed into the body without the requirement for another needle, where it dissolves in the tissue and is released to the body.
1/3 of patients, they don't have a suitable vein for coronary artery, hence patient into mortality, they may die, So this is the first coronary artery bypass we developed could overcome this problem.
I relaxed by making little objects like this. I thought, why can't I use this in my clinical practice?
Opportunity to showcase our product is fantastic, and obviously any money that we win will help us further the research.
The brilliant Mr. Rory Bremner and the absolutely fabulous Miss Joanna Lumley.
My lords, ladies and gentlemen, welcome to what is easily the most exciting event taking place anywhere in this tent tonight.
Winners are Dr. Nicholas Coleman and Professor Ron Lasky from Cambridge for cancer biomarkers.
The winners are...
The winner is...
The winner of this award is...
The winner is...
For Sinova Neurotech.
Gene Search.
Positive Mental Attitude League.
And we are always left with that thought that if only this had been discovered quicker, diagnosed faster, that the people who we've loved and lost would be with us still. So it gives it a particular resonance, I think, to give the award to people who are enabling cancer to be diagnosed at an earlier stage.
I'm a completely amateur inventor myself, so anything that is truly important and truly thrilling in the medical world attracts and appeals to me. And the idea that I'd be coming along and seeing some of the newest ideas in the sort of future of medical treatment of people was absolutely thrilling.
What's different about this is, in all of the categories, all of the remarkable inventions and the difference that they'll make to people's lives, and like all the best ideas, they're just so simple.
These deaths can be avoided by new technologies, by better care, and particularly in this country by catching up with other countries.
Happily, I think it went to a fantastic scheme, which is essentially bringing people who have had mental health episodes really back into the community and really out into the light as human beings rather than as problems.
Thank you. Thank you very much.